The key concepts to behavior therapy include conditioning, both classical and operant, and social cognitive theory or observational learning. These primary concepts are used to change undesirable behavior or target behavior. Let's first take a look at conditioning. There are two types of conditioning, operant and classical. Classical conditioning is based on the work of Ivan Pavlov, who is famous for observing dogs salivating an unconditioned response prior to receiving food or the unconditioned stimulus. Pavlov then introduced a bell or conditioned stimulus with the food, which created a conditioned response, so that when the bell rang, the dog salivated. This is a type of learning in which a neutral stimulus is presented repeatedly with one that reflexively elicits a particular response, so the neutral stimulus will eventually elicit the response itself. The focus of classical conditioning is on the antecedents of behavior. Operant conditioning, on the other hand, is based on the work of E.L. Thorndike, who derived the law of effect, that is, consequences that follow behavior help learning. B.F. Skinner, however, is most associated with operant conditioning. Operant conditioning is a type of learning in which behavior is increased or decreased by systematically changing its consequences, and the focus is on antecedents and consequences of behavior. Well, let's take a look at an example, and you decide, is it operant or classical? So Shelley and her dad are at the grocery store. As they near the checkout stand, Shelley starts whining for a candy bar, but Dad says, "No, Miss Sally, no candy for you before dinner." And she begins to cry, and cries louder when her dad continues to refuse her the candy bar. By the time they get to the checkout lane in front of the cashier, Shelley throws herself onto the floor and begins screaming hysterically. Her dad, as his anxiety increases and his embarrassment increases, responds by grabbing a candy bar and giving it to her. She quickly quiets down and eats her delicious chocolate candy bar. This exchange results repeatedly on subsequent trips to the grocery store. So what do you think? Well, the answer is operant conditioning with reinforcements. This example highlights many of the key concepts of operant conditioning. Shelley's whining, crying, and temper tantrum is an overt behavior observable by her dad and just about everybody else in the store. Shelley's temper tantrum behavior is positively reinforced when receiving a candy bar, which is the behavior that she repeats and her dad reinforces, typically when they go to the store together. Now, if Shelley then uses this type of behavior to get a toy when passing the toy aisle at the store, she has generalized her behavior to a different stimuli, the toy. However, Shelley reacts differently with her mom in the store because her mom typically does not give in and give Shelley candy, particularly when she asks for it or when she particularly throws a temper tantrum. Because the stimulus condition is different between her mom and her dad, she is said to be using discrimination or reacts differently between her trips to the store with her mom and her dad. Her mom uses extinction in that she ignores Shelley's behavior when she throws a temper tantrum, and Shelley has learned throwing a temper tantrum just does not work to get her candy when she's with her mom at the store. Therefore, she does not typically exhibit this behavior. Now, on the other hand, Shelley's dad receives negative reinforcement in that the undesirable behavior of Shelley's temper tantrums stop, and then Dad gets the desired result of a little peace and quiet and less anxiety. So this behavior pattern is typically repeated time and time again and will probably repeat in the future. Now, if Dad takes a tip or two from Mom He may try shaping Shelley's behavior the next time they go to the store together by encouraging her to remain calm when she asks for that candy and Dad says no, until they return to the car, at which time, if Shelley's done well, Dad can praise her positive behavior, which is a positive reinforcement, and may additionally reinforce that behavior with an ice cream cone and a little bit of quality time with Dad on the way home. Now, the other major concept in behavior therapy is social cognitive theory. Now, this focuses on the study of covert behaviors, those that take place within the individual and cannot be easily observed. Albert Bandura is associated with social learning theory and emphasized the interaction between environment, personal factors, and behavioral actions. Bandura didn't believe reinforcements explain learning and personality development adequately. Instead, he believed that learning took place through observing and modeling. Attentional processes refers to how one perceives what one has observed. Retention process is remembering what has been observed. To translate the observed or modeled behavior into action, it is considered motor reproduction. For the reproduced behavior to continue, a positive reinforcement in the form of an incentive is typically required and is a motivational process. So an example would be winning a pink Cadillac for selling a certain amount of Mary Kay cosmetics. And self-efficacy is an individual's perception of her ability to deal with different types of events. Those with high self-efficacy are typically more successful than those with low self-efficacy. So the goal when utilizing these key concepts in behavioral or cognitive behavioral therapy is that the target behavior will change.